Peace be to you all. Assalamu alaikum. Omar Abdul Malik, physician, associate, and health educator. So today, I am going to answer some questions about the COVID-19 vaccine and how it's affected me. Forgive me if I don't answer people's questions right away or respond to certain comments because I'm extremely busy, so I try to do it as I can. Hey there. So for those of you guys that don't know, I've been a PA and a health educator for more than 20 years now. And the past several years, I've been working as a hospitalist PA here in Washington, D.C. So, as such, we get a good number of patients who have had COVID. They're not allowed to come into the hospital, be admitted with COVID, so we screen them before, but a lot of them are status post-COVID. Some are on ventilators, or they've been intubated, or they've had tracheostomies or mechanical ventilation. Others are on a high-flow nasal cannula. But I've seen firsthand what this virus can do to people. And I don't want to get political because it's become like everything, it's become a hot button political issue. But this is science. And I take care of adults. In particular, most of them are over the age of 50. So they have age-related polymorbidities. So hypermetabolic syndrome, CHF, congestive heart failure, poorly controlled diabetes, hypertension, some are on dialysis, and then some are frail elderly. Others are so sick that we usually transfer them to palliative care or hospice care. They've got metastatic carcinoma and are in the end stages of their cancer. Some have very compromised immune systems, so they've got AIDS, CD4 count in the single digits. So that's the type of, that means you have almost no immune system. So that's the type of patient that I care for. You know, me and my colleagues. Having said that, I made the choice to get the vaccine, and I had misgivings about it, to be very frank. Yeah, like I think given the racial history in this country, but also because I was ignorant of many aspects of the vaccine and still am. I'm not an expert. That's not my field of expertise. And even the experts, quote unquote, it seems like they're saying one thing 1 month, then 2 months later they're saying something else. So it's kind of like, well, wait, we the public, and rely on you guys with the highfalutin degrees to educate us, give us efficacious education, and then we have a choice to act upon it or not. And I got some degrees behind my name. But, that's just to give I tell you about some of the things I do, my background and field of expertise. But I did not want to, I got the vaccine because, and I got Moderna, I did not want to take a chance that I would be one of those few people that were either asymptomatic or low symptomatic, had COVID, and then would come to work. Maybe I think I just had the bad case of the sniffles or allergies, but in fact I would have had COVID-19. Then I'm breathing all over my patients, some of you all's family members, and then give it to them. And then in their very sick or frail states, their bodies can't handle it. The Lord's allowed me to shake things off when I've gotten sick, whether it's pneumonia or the flu. So I think, God knows best, but I think I would have shaken the COVID off. Lord willing, inshallah. But I didn't want to I hold myself to a very high level of accountability when it comes to caring for my patients. I don't want to, I took an oath, do no harm, you know. So that includes trying to do what you feel you can do. Hey guys, good morning.
Good morning.
Doing what you can do, or doing what I can do as a clinician to not harm my patients. So that segues into side effects that I've had. I got the vaccine, I want to say about 5 months ago now. It's August 6th, I think, today. So I got it about 5 months ago. Of course, there was pain at the injection shot. I don't have a lot of fat or muscle, so it really hurt. And then later that evening, I was really sick. This is after getting the second vaccine. So that's just the response, your body responding to the vaccine and creating antibodies. And then I was fine the next day. In fact, I worked out. I didn't know. Hi there, morning.
Good morning.
I didn't know about the myocarditis. That's a rare instance in which some people, especially young men, get inflammatory heart disease. In rare cases, some have died. But people are encouraged not to engage in rigorous exercise after getting the vaccine, at least for a couple of days. I didn't know about that. I'm not a young man anyway, I'm in my 50s. But I have not felt any what I feel to be side effects that I could attribute to the vaccine. Since that time, I feel a bit tired, but I think it's just because I'm getting older. I am pushing 60, but I'm out here trying to do what I can to hold this more than half-century body together. Inshallah. But that's it. And I also want to say that we have to be respectful to other people's beliefs and their opinions. I try to do that. You know, even no matter how vehemently I may disagree with them. There's people who've told me that they believe the vaccine is the mark of the beast. There's other people who don't want to get it because they're afraid of getting those rare side effects. There's other people who don't want to get it because, just for their own philosophical / religious / political beliefs. And while I might not agree with them, I want to be respectful. You know, one of the things that we have in the hospital where I work is a code status for patients. So we have patients who are what we feel to be literally at death's door. They're elderly, frail, they're dying. They're literally actively dying. We got them on pressors, multiple pressors, just to keep their blood pressures up. And the families still want them to be full codes, even though we tell them that their parents' prognosis is very poor. You know, CHF with an ejection fraction of 15, and they're septic and respiratory failure. But they're like, no, God's gonna heal my parent. You don't know. Hey there, morning.
Hey, hi.
You're not God. So I may not agree with that, but I have to respect it, and I try to respect it. Others may want their loved one to be a DNR, and I'm like, well, you know, your loved one doesn't really have anything. They had a car accident, and they're not brain dead, so to speak. They're just a mechanical ventilation. I had a patient family member ask me if I could give their loved one something to kind of speed up the process of them expiring. I was like, no, I'm not Dr. Jack Kevorkian. Are you kidding? Yeah, we give morphine if we terminally wean somebody. That's another issue. But just respect for each other and our beliefs. Hey there, how are you? And just trying to disagree agreeably. It's very difficult, especially in this day and age. We're fighting wars, we're fighting each other. But if you guys have any thoughts about this, please feel free to share them respectfully. Okay, take care. Peace.